Hi everyone, my name is Terry Schroeder and I'm the Program Director for the Student Services Department. And one of my roles as the Program Director and as a registered nurse is to oversee the school health programs in our district. That's one of the reasons why I'm bringing you this training today called Back to School Training for COVID-19. So let's start with the background of COVID-19. First of all, there's several different names that this has been identified as. The first one is coronavirus. The second one is COVID-19. You may have also heard it called the novel coronavirus or the SARS-CoV-2. So coronavirus was first identified in Wuhan, China in late 2019. COVID has a specific meaning. The CO means corona, the VI means virus, the D means disease, and 19 stands for the first year it was identified. You also may have heard it called the novel coronavirus. That means that it's brand new. It's not been previously seen or identified in human beings. And the last term you may have heard of is the SARS-CoV-2. That is the scientific name for COVID-19 or coronavirus. It's used usually in studying, testing, and in animal health. So let's talk just a little bit about how the virus spreads. First of all, it's spread mainly from person to person. It's spread through respiratory droplets, which happens when you cough, when you sneeze, when you talk, chanting, shouting, or singing. Droplets then land on the persons nearby, whether it's their mouth, their nose, or maybe even inhaled into the lungs through breathing. Spread is much more likely when people are in close contact, within 6 feet. The more closely a person interacts with someone, and the longer that interaction takes place, the higher the risk of spread. Spread is also considered through touching a surface or an object that has the virus on it, and then touching the mouth, nose, or eyes after that. You may have heard the term community spread. Let's talk just a little bit about what that means. People have been infected with the virus in a specific area, including some who are not sure how they became infected. Each health department across the country determines spread differently based on their local conditions. We in Okaloosa County get updates every week from the Department of Health. As of Monday, August the 10th, Okaloosa County has sustained community transmission of the virus that causes COVID-19. Now, we are doing better. Over the last couple of weeks, there has been a decrease, so we are headed in the right direction. Let's talk for a few minutes about the symptoms of COVID-19. The symptoms may appear anywhere from 2 to 14 days after exposure to the virus. They can range from mild to some get very severe symptoms. Some may not have any symptoms. We call that asymptomatic. So according to the CDC, we currently have 11 specific symptoms identified. First of all, it's fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, a loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and then diarrhea. This list isn't all-inclusive, and there may be other symptoms. The CDC does continue to update that list as they learn more about the disease or the virus. A lot of people like to compare the flu with COVID-19. You'll see here that there are a lot of similarities, but there are also some differences too. So let's compare the two. First of all, both are viruses. In the flu, there's really not a symptom for the loss of taste or smell, where there is in COVID-19. With the flu, symptoms develop in a shorter time period, usually 1 to 4 days after exposure. In COVID-19, symptoms take a little bit longer to develop, anywhere from 2 to 14 days after exposure. In the flu, people can be contagious about 1 day before symptoms start, and they're most contagious during the initial part of the virus, 3 to 4 days in. But they remain contagious up to 7 days. With COVID-19, people tend to be contagious 2 days before symptoms, and they remain contagious up to 10 days after symptoms first appear. So obviously that one is longer. In the flu, there's a higher risk of complications for healthy children. Both have a high risk of complications for children with underlying medical conditions. Flu, there is FDA approved antiviral medications and FDA approved vaccines. There's no such at this time for the COVID-19 virus. Now, there's studies that are ongoing for both medications for treatment and for a vaccine, but currently there's nothing that's FDA approved at this point. So let's look at prevention and mitigation. Here's a list of all the things that we can do currently to what we call prevent or mitigate COVID-19. We're going to look at each one individually, but let's look at the list comprehensively first. You've all heard of washing your hands, avoiding close contact, cover your mouth and nose with a mask, cover coughs and sneezes, clean and disinfect frequently touched surfaces, monitor your health daily, and please stay at home if you're sick or if you have been identified as a close contact of somebody with COVID-19. We need to be washing our hands often. We've learned this as children. We grow up learning this. We grow up teaching our kids this. We need to wash our hands for at least 20 seconds. One of the things that I've taught children through the years is to sing happy birthday to you as you're washing your hands. Now, if you're an adult, you probably shouldn't do that out loud. If you're a child, go ahead and allow them to enjoy the fun in doing that. But that takes about 20 seconds. So if you sing that song while you're washing your hands, you've covered your 20 seconds. So here are some key times that we do need to make sure that we're washing our hands. After blowing your nose, coughing, or sneezing, especially if you cough, sneeze, or blow into your hands. Before eating or preparing food, before touching your face, after using the restroom, after leaving public places, after handling your mask, after changing diapers or assisting children in the bathroom, after caring for somebody who's sick, and after touching your animals or pets. If soap and water is not readily available, we can use hand sanitizer, but the hand sanitizer needs at least a 60% alcohol content, and the hand sanitizer must dry to be fully effective. This is not recommended to be done all day long. We do need to, at some point, usually it's after 3 to 5 sanitizing, that we need to make sure we're washing our hands with soap and water. And then, of course, avoid touching your eyes, nose, or mouth with unwashed hands. Everyone's heard of social distancing. Whenever possible, we need to maintain 6 feet between others. When not able to maintain that 6 feet between others, it is strongly encouraged that you wear a mask. And this is to help prevent those droplets because there's a certain space that those droplets can spread. Covering our nose and mouth around others. Because it is possible to spread COVID-19, even if you're not sick or if you're asymptomatic, it is strongly encouraged that you wear a cloth mask around others, especially when social distancing can't be maintained. A mask is actually meant to protect others in case you are infected. When a mask is worn, it should be worn correctly, and correctly means covering both the mouth and the nose, which is where respiratory droplets can come from. In certain cases, masks shouldn't be worn. Those cases are for children under 2, anyone with breathing problems, anybody that's unconscious or incapacitated, or if they otherwise can't take their mask off without assistance. When possible, social distancing should be practiced while wearing a mask. It just adds an extra layer of coverage and protective. Always cover your mouth and nose with a tissue when you cover a cough or sneeze, or use the inside of your elbow. avoid using your hands to cover your coughs and sneezes. Throw away any tissues that are used in the trash immediately, and then wash your hands with soap and water for at least 20 seconds afterwards, or use a hand sanitizer with at least 60% alcohol if you're not able to wash your hands immediately. Cleaning and disinfecting. Those two terms are sometimes used interchangeably, but they actually do have separate meanings. Cleaning involves the use of soap and water, and it reduces the number of germs on surfaces. Disinfecting kills germs on surfaces and requires the use of some type of EPA registered disinfectant. And this will be provided to you through the Facilities and Custodial Services Department for you to use at your work sites. We need to make sure that we are frequently wiping down high-touch surface areas using the products provided by the Facilities and Custodial Services Department. And you'll get these through your classroom COVID kits, and we'll talk about what's in those in just a minute. But these frequently touched surfaces include things like your tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, sinks, and faucets. Anything that's touched frequently and on a regular basis. So all classrooms and itinerant staff that provides direct service to children will be getting what we call the Classroom COVID Kit. What's in this kit? So we've listed some things here that you'll find in that Classroom COVID Kit. First of all, it's individual desk barriers, one for everybody in the class and the teacher, a no-touch thermometer, cloth masks for the teacher and the students, gloves, hand sanitizer that is mounted to the wall, a hand sanitizer bottle, signage that promotes hand washing, social distancing, and mask wearing, a spray bottle of disinfectant, and then there will also be a bucket that has wipes and disinfectant. You've probably heard the terms quarantine and isolation. And these two are used a lot of times interchangeably. However, they do have separate meanings. Quarantine is used when someone might have been exposed to COVID-19 and they need to stay away from others. When someone is quarantined, they need to stay home for 14 days from their last contact with the person who has COVID-19. We want to monitor for symptoms during the quarantine. It's important to note that a negative COVID-19 test does not end or decrease the 14-day quarantine. And also note, persons who quarantine in the same household of a positive case, they do not start counting quarantine days until the positive case is recovered. So for example, someone tests positive for COVID-19. They are home isolated for their 10 days. They're better. Then the person who's in quarantine in the same household with them, they start their count of their 14 days for their quarantine, because during that time when they're at home together, that they could be shedding virus that entire time. So there could be a chance that somebody would be quarantined up to 24 days. Let's talk a little bit about isolation. Isolation is used for somebody who is infected with COVID-19, and this keeps that person separated from people who are not infected. People who have symptoms and are able to recover at home, they're supposed to isolate for at least 10 days from the onset of symptoms, and at least 24 hours with no fever without the use of medications, and that when their symptoms have improved. So let's be real clear. Somebody is sick with COVID-19 at home. Let's say they're coming up on their 10th day and they still have symptoms on day 10. Well, they will not be released from isolation at that 10-day mark because they still have symptoms. They will need to be symptom-free without the use of medications for at least 24 hours after that 10th day before they're released from isolation. Some people who have asymptomatic COVID-19, those folks, they will be released from isolation 10 days from the date of their positive test. because we can't measure symptoms with those folks because they don't have any symptoms. They are asymptomatic. What do you do if you're sick? Well, first of all, don't come to work. We want you to stay at home. We want you to self-isolate. Only leave your house if you're sick just to get medical care or testing for COVID-19. We want you to monitor your symptoms, and if you have any of the following symptoms, you're going to want to seek emergency help, emergency medical care. And the emergency warning signs include trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or to stay awake, or bluish lips or face. That does mean that you're having trouble maintaining your oxygen in your bloodstream. We want you to stay at home for at least 10 days from the onset of symptoms, and again, at least 24 hours symptom-free with no fever, without the use of medication, and your symptoms need to have improved. Very, very important to note and understand, if you have been tested for COVID-19 due to an illness or an exposure to a positive case, you should not come to work. You need to stay at home until you have those results back, because if you are positive and you come to work, you could be exposing your colleagues and your students and anybody else that you are around during that time. So wait at home for your test results. All right, at this time, we're going to take just a minute and we're going to bring in Lindsay Maxey from HR so we can talk about what happens from the HR side of the house if you do have to isolate or quarantine.
Thank you, Terry. As you said, we're going to talk a little bit about what you would do if you need to quarantine or isolate. If you do have symptoms of COVID-19, have tested positive for COVID-19, or have been identified as a close contact of a positive case of COVID-19, you will potentially need to isolate or quarantine. Your building administrator will work with Human Resources to determine your need and/or length of any quarantine or isolation. Please have the following information readily available: the date of your first symptoms, the date, location, and type of COVID-19 test that you had, the last date at your work site, and also, if a member of your household has tested positive, we will need to know the date of their last symptoms. Now, we are also going to address leave while under quarantine or sick with COVID-19. There are 3 banks of leave available to you, and we're going to discuss each. We have the FFCRA, which is the Families First Coronavirus Response Act. We also have district paid quarantine leave, and then finally the employee's own sick leave bank. So first, let's talk about the FFCRA. This leave includes 10 days of paid emergency sick leave and can be used in the following situations. The first is if you have your own COVID-19 symptoms or you have a confirmed COVID-19 test. The second is quarantine due to a close contact outside of the workplace. Or the third is caring for a family member with COVID-19 symptoms. Now, one thing to note is the district is going to provide an additional 5 days of emergency medical leave for those employees whose documented personal COVID-related concerns extend beyond the 10 days. If an illness goes beyond this 15 days, routine sick leave procedures will take place. The school district is also supplementing the FFCRA in specific situations. If you are identified as a close contact of someone in the workplace who is tested positive for COVID-19, you will not be required to use your own sick leave. You will be paid through district quarantine leave. Now, if you do develop symptoms or test positive for COVID-19 during your paid district quarantine leave, you will transfer over to the FFCRA leave. The last bank of leave that is applicable for COVID-19 is the employee's own sick leave bank. Employees may be required to use their own sick leave days if an employee has exhausted the FFCRA leave and is still experiencing symptoms, or if an employee is under quarantine due to exposure outside of the workplace. So that covers it. And if you do still have questions about quarantine, isolation, or leave, please reach out to the Human Resources Department and we will do our best to answer your questions.
Thank you, Lindsay. All right, let's talk about contact tracing. So first of all, let's understand what it is. Contact tracing is a process that we use to identify people, we call them contacts, who may have been infected by exposure to a positive case. The goal is to prevent further transmission of the virus by separating people who possibly or may have the virus. So a close contact, and this is a strong definition through CDC, a close contact is someone who was within 6 feet or less of an infected person for at least 15 minutes. Now, we look at this based on 2 days before symptoms began in the positive case, or for those folks who don't have symptoms, 2 days before being tested. Close contacts are asked by the Department of Health in Okaloosa County to self-quarantine for 14 days from the day of the last contact with a positive case, and then they're also asked to monitor for symptoms while they are in that quarantine. The symptoms develop, then they seek medical care, or they seek testing. If it's mild, it would be whatever is safest for that person. You may have heard the term a contact of a contact. This is someone who has been in contact with someone who has been identified as a close contact to a positive case. We call that a contact of a contact. Contacts of contacts should monitor their health, but they're not asked to quarantine, and they may continue their normal activities, including coming to work or school. Something to think about. Currently, masks being worn and clear plexiglass dividers really is irrelevant on who is identified as a close contact to a positive case. That being said, both those things help to decrease the spread of the virus, but when we have to do contact tracing to determine who's a close contact, neither of these things are taken into consideration to eliminate a person from being a close contact. In classrooms, one of the biggest things you can do to help contact tracing is to have seating charts, and then to follow those seating charts as closely as possible, because then this will help us identify who in a classroom may be identified as a close contact of a positive case within a classroom based on who was sitting where at that time. So Okaloosa County School District has created a COVID response team, and this COVID response team will collaborate with the Department of Health in Okaloosa County to conduct contact tracing within a school environment. And what they'll do is they'll look specifically at the impact of a positive case within a school or classroom environment and determine the safety of those school district students and staff, and identify who is close contacts within whichever environment that positive case was involved in. So what happens when a student or an employee tests positive? So, of course, Lindsay already mentioned, you'll contact your site administrator, who will notify at that time the COVID response team to begin the process of contact tracing. As has been mentioned several times, the student or employee will be excluded from school for 10 days from the onset of symptoms and until fever or symptom-free for 24 hours without the use of medications, or if the person is asymptomatic for 10 days from the date of the test. The positive case will then be investigated by the COVID response team relative again to the impact on the school and to identify those related close contacts to that positive case. Close contacts will be notified and required to quarantine and monitor for symptoms for 14 days, again, from the day of the last contact with that positive case. So let's say, for example, somebody tested positive on Wednesday, but they weren't at school since Monday. Well, the last day of contact for that positive case would be Monday. So that's where we look at, and that's where the quarantine would start for those that are identified as close contacts, 14 days from the last day of contact with that positive case. All right, so what happens when a student or an employee is identified as a close contact? So students and staff that are close contact of a COVID-19 positive case, again, will be required to quarantine for 14 days from the last day of contact with that positive case. As mentioned earlier, a negative COVID test does not shorten or end that quarantine. And this is because symptoms can develop anytime between 2 and 14 days from the day of exposure. Siblings and family members of close contacts identified from a case within a school are considered a contact of a contact. So that means they're not required to quarantine, but they need to be very careful about socially distancing from that close contact within the home and monitor for symptoms. And then at that point, if symptoms do develop, medical attention should be sought, COVID testing should be sought, and depending on the outcome of that testing and that medical evaluation, that will determine whether that person becomes a positive case or a close contact. So what happens when a student becomes sick at school? Well, the first thing you're going to do from your classroom is you're going to send that student to the clinic. The clinic staff is going to evaluate that child according to the COVID-19 clinic documentation school. This is an MIS document. Its number is 6064 if you want to take a look at that. But we have developed an actual tool that we're going to use to help do our screening for these symptoms and these children within our school environment and in the clinic. So if the student is sent home from school with COVID-like symptoms, they can return to school under these circumstances. So the first is, if they get a negative COVID test, they go and have testing done, and the test result is negative, and they're symptom-free for 24 hours without the use of medications, they can come back to school. If they are evaluated by their healthcare provider and they are given an alternative diagnosis other than COVID-19, let's say the kid's asthma is exacerbated or worse, maybe the kid has a sore throat because they've tested positive for strep, those kinds of things. So those would be alternative diagnoses other than COVID-19. The student would still have to be symptom-free of the symptoms they were sent home from school with. So that would include no fever or no other symptoms of that. In this situation, they can come back after they're symptom-free for 24 hours without the use of medication. However, if there is an alternative diagnosis, a doctor's note or a healthcare provider's note is going to be required in those cases. Now, let's say the family chooses not to do a COVID test and they choose not to go to the doctor, then we're going to have to revert back to the standard CDC guidance where the child will have to be excluded from school for 10 days from the onset of symptoms, and they must be symptom-free for 24 hours after that without the use of medication. So those are what's going to happen if we send a child home from school related to COVID-like symptoms. Those are the three alternatives or options we can look at. What do we know at this time about children and COVID-19? So the limited data that we do have suggests that children are less likely to get COVID-19 than adults are. When children do get COVID-19, they generally have less severe illness, and many of them are actually asymptomatic or without symptoms. Currently, most evidence suggests that children become infected from a family member. Children with underlying medical conditions, those who are medically complex, those who have neurologic, metabolic, or genetic conditions, or those that have congenital heart disease may be at an increased risk for severe COVID-19 illness compared to other children. And lastly, we do see more cases of COVID-19 being reported among children with intellectual or developmental disabilities compared to those without those disabilities. So how do we help kids cope with COVID-19? First of all, as adults, we want to stay calm, we want to listen to them, and we want to offer reassurance. We all know that children react from adults and our examples. We want to be aware of how we talk about COVID-19, especially in front of them. Our words will increase or it will decrease. They will decrease a child's fear. We want to explain to them and we want to teach them the mitigation measures that we talked about earlier on in this presentation. We want to help children learn coping mechanisms such as deep breathing. We use that as a calming tool as adults all the time. And then we want to practice it with them regularly, whether it's in a classroom, in the lunch area, out at PE. We want to just teach them how deep breathing can help them to calm down. We also want to establish and maintain daily routines. For children, regular routines allow them a sense of control. It gives them a sense of predictability and it helps them to be calm. This is going to be a difficult year for routine anyway because most of them have been out of circulation, out of schools since March. So again, these routines for them, to establish those routines, are going to be very important. We want to provide developmentally and age-appropriate and accurate information on COVID-19 to help dispel some of the rumors they may have heard while they've been out over summer or during quarantine time back in the spring. And that also helps them to understand some of the inaccurate information that they may have seen or heard or been given. Let their questions guide you. Always answer truthfully, but don't offer too much information. Too much unnecessary details can be confusing for them. And really don't be afraid to tell a child that you don't know the answer to something, but you'll be happy to see about finding that out for them. That's okay. They get that because sometimes they don't know the answers and they have to go find out. So I want to leave you with this thought. Life isn't about waiting for the storm to pass. It's about learning to dance in the rain. Here we are right now learning to dance in the rain around this situation with COVID-19. We are learning to dance our way into the 2020-2021 school year. We've got this, Team Okaloosa. So if you have any additional questions about any of this that we've discussed today, you can reach out to me. My office number is 833-3108. You could also email me at teresa.schroeder@okaloosaschools.com. Thank you.